9, 8, 7, 6, 5, 4, 3, 2, 1.
Hello everyone! Luzon, Visayas at Mindanao. I am Dr. Shi Armero, your friendly OBGYN and lifestyle medicine physician, and you are watching Dangpanan, a Doc Shi TV live health talk series. If this is your first time watching, we do this training regularly and simultaneously in Facebook and in YouTube, Doc Shi TV. So if you're watching from YouTube, please click that subscribe button and turn on that notification bell for you to be notified on future videos. If you're watching from Facebook, click that follow button and share away. The goal of this program is to get in touch with you, modern Filipinas, to various social media platforms to empower you to take charge of your health through correct and science-based information. Dangpanan, a Bisaya term for shelter, is chosen to be the name of this program because I want to share this shelter of comfort and good education to you, my dear viewers, through a platform that is accessible to all. Welcome to another educational health talk. And what's more, you do not just learn. Lucky viewers will also get a chance to win a free online consultation coupon. So, stay tuned till the end because you might be today's lucky winner. So invite your friends by typing their names in the chat box and click that share button. Don't forget, ako ang inyong Dangpanan, hashtag Dangpanan DocShi TV or hashtag DDS TV.
Dangpanan, kabahin sa panglawas o relasyon. Doc Shi Armero.
Dangpanan. It's been how many months na ba? August, September. Almost 3 months that we have not had our health talk series live here in Facebook. Hello to our viewers. Yes, I miss you too. Hello, Kuya Junel. Watching from Bourbon. Ate Jeannie. Hello from Bohol. Yes, thank you for being with us. Reyes Nunez. Hello, good afternoon to you. No? So, to all our watchers anywhere in the Philippines or all Filipinas around the world, good morning, good afternoon, good evening. It's quite a rainy afternoon here in Cebu. I hope everybody is safe at where they are now. Type in, okay, from where you are watching so I can greet you. Wow, thank you for tagging all those names for this afternoon's session. Okay, so as I had been posting for several days already, I hope you can hear me well. Just let me know if medyo hindi maganda ang reception. Okay? So, all right. For the past days, I had been posting about the pregnancy loss day celebration today. This is quite a close topic to my heart because on my succeeding posts, I told you that I had my own share of pregnancy loss story. And if you have time, you can visit in our website. Our website, I made a post in the page where you can visit our website, but please visit our website. It's obstetricianphilippines.com. Some of my blogs are there. You can read through it. And my blog about my pregnancy loss is dealing with the loss of Benedict. So there you go. So, okay. So please, if you have time, visit our website. So hi from Lapu-Lapu. Faith Tantoy, hello. Thank you for watching. Hi, Ma. Yes, I'm back. Yes, we're back again for Dangpanan. No? We're having a wonderful topic this afternoon. I hope you will learn from it. Thank you, loud and clear. Daghang salamat. Okay, Sheila. Yes, wow, from Masbate. Hi, Sheila from Masbate. Thank you for being with us. Oh, from Talisay. Hello, Kling Canyalas. Thank you very much for having your afternoon spent with Dangpanan. I hope you will learn a lot this afternoon. Oh, wow. Beauty Plus Salon and Aesthetics. Oh, hello. I was planning to go back to Butuan at the end of the month because I plan to celebrate my birthday there. Hello to my cousins, the Halads from Butuan. Hello from us here in Cebu. We miss you all. The kids all miss you there. I plan to be there at the end of the week in Butuan to spend my birthday, but we had a change of plans. We're spending it in Bohol with my family. And because my very dear friend, Joy and O'Neill, they are getting married. And so we're going home. Yay! So shout out to you. Congratulations in advance. Okay. All right. So, wow, what a wonderful audience this afternoon. Thank you very much. Okay. All right. Hello. Jason, yes. Hi. Hello. Thank you very much for your time this afternoon. So, without further much ado, let's move on to our topic. This is a very significant one in response to the day that we are celebrating. It's Pregnancy Day. Okay, let me share my screen. Okay. Hold on. I think you can see it. I'll remove it first para hindi siya magulo tingnan. All right. I think it's ready. Okay. Oh, yan. Ang ganda. Pink and blue. Hello, Kim Ray June. Thank you very much for watching. Yes. Oy, Papa. Pa, thank you. Yes, from Halad Health and Wellness Clinic. Yes, we have a clinic for our patients there in Bohol. Our clinic is open in Santa Fe, Albuquerque, Bohol. My parents, Doctors Loy and Shawnee Halad, are your physicians there. So visit us, okay? So let's start our topic. Parang na-excite ako masyado. Okay. So this is titled Never Forgotten, no? It's a wonderful title for our talk. And then please just chat, just comment below if you have questions so I could answer to them at the end of this lecture. Also, of course, because we'll be giving away free online consultation coupons. I have 3 questions at the end, so I hope you will be one of the 3 lucky winners today. All right. So ang miscarriage and abortion, biglang naghang ako. Just let me know if there is a problem at your side. Okay? So ayan. Let's define spontaneous abortion. Dapat may first name. There should be a first name. Spontaneous abortion. This spontaneous abortion is also known as or otherwise known as a miscarriage. Yung hindi sinadya. Na-abort lang ng hindi sinadya. Okay? It is non-induced termination or loss of pregnancy from whatever cause because the fetus is incapable of extrauterine life. Okay, before the fetus is capable of extrauterine life. Tama pala. Okay. So ayan, again, it can be interchangeably used. Spontaneous abortion and miscarriage. Kaya lang, Medyo negative kasi ang connotation ng abortion, kaya mas magandang pakinggan na miscarriage. So we can just call it spontaneous miscarriage or just miscarriage. Yan. So, ano bang cause? Bakit ba ako nakunan, Doc? Ang dami-dami ko nang na-research, ang dami-dami sinasabi si Google. Totoo, there are a lot of causes and risk factors of pregnancy loss. These are just 9 of the most common. Kasi pag isa-isahin ko yan lahat, ako bukas pa tayo matatapos. Alright? So the first and very common, especially if the fetal loss happened early in pregnancy, kadalasan it's fetal chromosomal abnormality. Hindi maganda ang chromosome na nabuo kay baby, kaya hindi siya nakapag-survive ng length ng pregnancy. Infection also plays a role. Yung mga hindi na-treat na infection, pwede din siyang maging isang cause. Number 3, cervical weakness. Cervical incompetence o yung nakunan ka na medyo around early second trimester. Yung hindi walang masakit sa balakang, tapos bigla na lang lumabas si baby. Yon, cervical weakness yung ganon. Or may uterine anomalies. Later on, ipapakita ko, I will show you how a uterine anomaly looks like. Ano bang mga uterine anomalies na risks for a miscarriage? Another risk is the advanced maternal and paternal age. Ibig sabihin, the husband and wife, the couple na bumuo kay baby, medyo nasa higher age group na. So pag ang couple na ganyan, they risk na makunan si wife. Okay? Number 5, previous spontaneous abortion. Kung ikaw nakunan na previously, may risk ka ang makunan ulit. At yan, mas malaking problema. Because according to the association that studies about this, pag nakunan ng twice, there should be further test na gawin sa inyo. Of which, again, I will show you later. Doktora, ang kape ba, can it be a cause of miscarriage? Yes and no. Depende on how heavy caffeine drinker you are. And I'll show it to you also later. Obesity, yung mataba o kahit yung overweight, pero hindi masyadong maganda yung weight prior to getting pregnant, yun. There is a high risk of miscarriage. Smoking, for obvious reasons, ang daming mga harmful substances na nasa smoking, and diabetes. You know, Filipinos, we are among those who are high risk of developing diabetes. You might not know, baka ikaw may diabetes ka na. So, hindi mo lang alam. So, these are patients who do not know that they have elevated blood sugar at nabuntis. So, yun, they are at risk of developing miscarriage. So, chromosomal abnormality, how is it related to pregnancy loss? Did you know that if the pregnancy loss happened before 6 weeks age of gestation, so that's around less than 2 months, 70% of it is caused by fetal chromosomal abnormality. So, may problema talaga kay baby. But it decreases chromosomal abnormality ang problema. Lalo na, as you can see here, if more than 3 consecutive losses in early pregnancy happen, it is unlikely, hindi siya mukhang because of the fetal chromosomal abnormality. It can be because of some other things, and the most common of it is APAS. I hope you heard about antiphospholipid antibody syndrome. Isa itong immunologic condition na nabubuntis si mommy pero hindi na ipagpapatuloy ang pregnancy. And the loss happens consecutively. Okay? So, yon. This was the one I was saying, reproductive tract anomalies, yung uterine abnormalities, very common, polyp. Okay? Ito itsura ni polyp. Polyp grows dito sa lining ng matres, and because nakikitira siya kung saan dapat nag-i-implant si baby, pwedeng makunan si mommy. Okay? Or submucous myoma, gaya nung polyp, nakatira din sa submucous myoma sa lining. Okay, ayan, nakita niyo ang pointer ko. Nakikitira din si myoma sa lining, kaya pwedeng makunan din si mommy. Or ito, this is not very commonly found unless may nagawang ultrasound prior, very early, at nakita ito. Septate uterus. Isa itong uterine abnormality na meron sa ibang babae and they are at risk or they had prior abortion already. Ito si septate. Kasi ang normal uterus dapat clear itong cavity. Dito kasi titira si baby. But with septate uterus, merong na may ibang nakatira. Ito, si septum. Okay? Parang ganito ba? Septum ng ilong. Hindi dapat. Dapat walang ganun si uterus. Okay. Nasabi ko na yata si cervical incompetence earlier. So, saan ba ang cervix? Nandito si cervix. If ito si cervix, hindi niya kayang i-carry yung bata, mag-open siya at malalaglag si baby. Yan ang cervical incompetence. Okay. Paternal age is showing you, parental age just showing you that women who are older has higher risk of miscarriage. And the risk increases after 30 years old. So sa mga nakikinig dyan, medyo bilis-bilisan na natin para hindi tayo aabot sa 35 to 40 because miscarriage is highest at 40 years old. Paternal, yung husband o yung male partner natin. Increasing paternal age is also significantly associated with a greater risk of abortion. Okay? So, ito sa study, sabi, pag ang lalaki is ages 25 or younger, the risk is lowest. However, as the age of the male partner increases, the risk of miscarriage also increases every 5 years interval. So, 30, 35, 40, nag-i-increase yan, yung risk of association of miscarriage. Ayan, ang dami-dami ko ng patient na tinatanong ito, Doc, should I stop drinking coffee? Kasi I'm a caffeine drinker. Okay. This is what I tell them to be safe. Okay. Moderate caffeine consumption, mga 1 to 2 cups of coffee per day or its equivalent effect. Yung ano ka lang, 1 cup lang, Doc, sa umaga. That's okay. But if you are a heavy caffeine drinker, that's around 2 to 3 cups per day or 200 to 300 milligrams per day, there is increased risk of miscarriage. Pag higher pa dyan, hindi miscarriage ang problema, infertility, hindi nabubuntis. So again, moderation lang po lahat para po happy tayo. Okay? So pwedeng mag-coffee 1 cup. Okay? Yan lang sabi ko, 1 cup. Obesity, na-mention ko na din ito, obesity. I'm very specific because apart from miscarriage, ang dami-dami pang risk or complications ng obesity in pregnancy. However, because our topic today is miscarriage, this is a study that proves that miscarriage in obese women is higher. Kasi binaliktad dito sa statement. Those women with normal BMI has lower risk of miscarriage than obese women. So pagbaliktad rin natin, obese women has higher risk of having a miscarriage in comparison to normal BMI. So, ibig sabihin, if you want a pregnancy that is successful, we should take good care of our weight even before getting pregnant. Smoke lang din masyadong common sa Pilipinas ang babae nagsusmoke. But marami na ding female smokers ngayon. But I just want to emphasize because majority, if not all, like 9 out of 10 of my male patients wish to help their wives become pregnant are smokers. So, dito nagkakaproblema because if the male partner is a heavy smoker, there is increased reactive oxygen species. Ano ba yan? Yan yung mga hindi magandang substances that accumulates in the body. Pag hindi maganda ang nag-accumulate na substances sa body, kahit merong antioxidant tayo, no? Paminsan-minsan, kumakain ng gulay, paminsan the stress that is so high in the body of the male partner, nagiging pangit yung contribution na sperm ng partner para maka-fertilize ng egg. So, kailangan kasi, di ba, isang sperm, isang egg. Dapat healthy sperm, healthy egg para healthy baby. Okay? So, yan, diabetes mellitus. Itong diabetes mellitus is also very important for us because may iba na, doktor, na buntis naman ako, wala namang problema. Okay, good. Ang tanong, until when will this pregnancy last? Especially kung hindi controlled ang diabetes natin. Mag-pen nga tayo para Isa itong test, so those who are diabetic knows what HbA1c is. Pag ang percentage ng HbA1c ay mataas, abot ng 12%, very, 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 very high risk of miscarriage. At itong sugar o fasting blood sugar na nakuha sa dugo, pag pag high siya, preprandial, meaning before eating, it's also high. We should be careful because ito siyang level na ito is high already, especially kung ikaw buntis ka. So, if you are wondering, if you are my patient and you are wondering, Doktora, bakit ako pinapaano mo? Bakit mo ako pinapatest? There are a lot of women who do not diabetic. So kaya we screen them. It's part of the recommendation to screen all pregnant women of diabetes. So pag may ganito, our goal is to control. Doktora, so ibig sabihin diabetic ako, so imposible na ako mabuntis or makukunan talaga ako? No. If you know that you're diabetic, but controlled ang sugar mo, nakikinig ka sa doktor mo, kumakain ka ng maayos na pagkain na hindi nakapag-spike ng sugar, as long as your sugar is controlled, successful ang pregnancy. That's the key. Kaya importante, alam natin how controlled the diabetes is. Okay. Ito na. Much talk about the risk factors. Let's talk about the clinical presentation. Doktora, how will I know na hala, makukunan na ako, hala, I should see a doctor. So if you also look, if you visit my YouTube channel, meron akong first trimester warning signs. Warning signs in the first trimester. These are the things that you should watch out for. Pag meron ka nito, you visit a doctor. One of the ones I mentioned, or hindi, two of the ones I have mentioned there are here. Vaginal bleeding and abdominal pain or hypogastric pain. Masakit ang puson. May spotting. Doktora, sabi nila normal lang daw ang spotting. May ganun daw talaga pag pregnant. Oo, may ganun. May implantation bleeding naman. Pero paano pag hindi? Paano pag makukunan ka na? So you visit a doctor. The presentation of a patient with the risk of miscarriage is mismenstruation kasi nga buntis siya. Na-miss niya ang menstruation pero dinugo siya. It can be spotting, moderate bleeding, or heavy bleeding. At masakit ang pusod. Tumatakbo sa likod, sa balakang. Okay? So those, although marami pang clinical presentation na pwede at I'll show here. Yan. Remember always, ito talaga, vaginal bleeding is the predictor or is the most significant predictor of pregnancy loss. Kaya, if may spotting, kahit spotting lang, please visit a doctor. Huwag mong, sa Monday na lang kasi hapon na. May online po para po magawa na ng paraan agad-agad. Okay? It's not something that you should put off. You visit an obstetrician right away, whether online or in clinic. Because vaginal bleeding is never a good sign. Okay? During pregnancy. Ito yung sabi ko that there are several other categories of spontaneous abortion at iba-iba po ang presentation nila. Number 1, may tinatawag na threatened abortion or threatened miscarriage. Alam niyo yung threatened, yung binibigyan ka pa ng warning threat. Hoy, quiet. Kung hindi, di ba, may ganun na threat pag si mami, ganyan. So, pag sabihin nating threatened miscarriage, hindi pa nangyayari ang miscarriage at may warning signs. Number 1, presentation nito, yun, spotting. But nung na-check ang ultrasound, okay pa yung heartbeat ni baby is well inside. So that's threatened miscarriage. Pwede yang isupport ng mga pampakapit or i-check what could be the possible cause. Bakit nagka-threatened abortion? Number 2, complete miscarriage or complete abortion. Ito yung dinugo ng malakas, may mga blood clots, tapos masakit ang likod. Tapos paglabas na lahat, huminto. Okay na, wala nang masakit ang likod. Huminto ang pagdugo. ang tawag doon, complete miscarriage kasi nalabas lahat. Hindi po kailangan itong raspa. Ito ang type of abortion na hindi kailangan ng raspa kasi po nalabas lahat. Kasi ang dami-daming nagme-message. Doktora, nakunan kasi ako last year. Hindi pa ako nabubuntis ngayon. Kailangan ba akong iraspa para mabuntis? Hindi po. Ang raspa po ay pag ikay nasa number 3. Dinugo, malakas, masakit ang balakang. Pero hanggang ngayon dinugo ka pa rin, malakas ang bleeding tapos masakit pa rin hanggang sa balakang. Ibig sabihin may natira pa po sa loob. Pag examine sa inyo, may mga products of conception pa yan na kasi pag hindi ang bleeding natin, pwede ikamatay pag hindi nalabas lahat ang mga products of conception. Number 4, inevitable. Ito yung hindi na favorite ko. Bakit? Kasi ito yung nangyari sa akin. I did not feel anything. Walang spotting, walang masakit sa likod. Wala! Bigla na lang nang nag-ultrasound. Wala nang heartbeat yung baby ko. So ito si missed abortion. Biglang masyashock ka na lang, ha? Wala na si baby ko, Dok. Bakit? Oh, yan. Yan si missed abortion. And last is the septic. Ito yung very common among those na yung may tinik silang gamot, tapos nagpa-abort sa gilid-gilid. Uy, totoo yun. May mga abortionist sa sansan lang. Tas yun, naglagnat, masakit ang tiyan. Wala na. Septic abortion, nagka-infection. Yan ang delikado. Yan ang yan ang pinakaayaw nating mangyari. Okay? So, I hope alam nyo yung mga categories. Again, it can be just threatened. Pag threaten, may magagawa pa tayo na ma-save yun. Number 2, complete. Wala nang magawa, nalabas lahat. Number 3, incomplete, may natira pa. Kaya kailangan ilabas lahat. Kundi, duduguin ka hanggat naubos ang lahat ng dugo. Isang importante, missed, walang nararamdaman. Tapos, nung na-check si baby, wala nang heartbeat. Yun. Okay? So, how to diagnose? Yun, di ba? I mentioned already, transvaginal ultrasound. Yes, ultrasound lang po. Mabilis lang yan. May marami kasi ding misconception about ultrasound. Intayin ko na lang, Dok, na mag-4 months si baby bago ako mag-ultrasound. Doktora, wala kasi. Gusto ko kasi na malaki na yung tiyan ko bago ako mag-ultrasound. Alam niyo po, importante, lalo na't merong mga signs and symptoms. Gaya ng spotting, masakit ang puson, kailangan pong mag-ultrasound. Bakit? Number 1, hindi lang po miscarriage ang pwede mag-present ng spotting at masakit ang puson. Ectopic pregnancy din po. Pwede pong mag-present ng spotting at masakit ang puson. Kaya kailangan transvaginal ultrasound para malaman natin saan ba nakatira si baby. Is the baby inside the uterus or is the baby somewhere else outside the uterus? And the second is the beta-HCG level. Meron din kasing cases na nag-positive ang home preg test kit. Masyadong excited, Dok, talaga, nag-positive na, nagpa-ultrasound agad. Nung nag-ultrasound, wala namang nakita. So, wala na, nag-depressed na. So, pumunta kay Dr. Armero, Dok, bakit ganito? Positive ang preg test ko, tapos wala namang nakita sa ultrasound. It can be, number 1, it can be too early kasi po, the earliest sonologic sign of pregnancy is a gestational sac seen at around 5 weeks pa po, age of gestation. So pag 1 week pa lang ang dumaan at nagpa-ultrasound na kayo, of course, hindi pa po yan makikita. So wala pong makikita muna sa ultrasound. But in relation to miscarriage, kunwari, dinugo, pag ultrasound, wala pong nakita. So, kailangan pong i-correlate natin sa level of pregnancy hormone. Yan si beta-HCG level. Ito siya si pregnancy hormone. Kung kumusta po ang level. If it is high, okay, baka masyado pang pag high, but hindi pa po umabot sa threshold na may makikita, we can just repeat. Parang dapat may serial measurement. Every 48 hours kasi po, nagdo-double ang beta-HCG. So, Monday, titingnan natin ang pattern of increase. Pag failing po ang pregnancy, instead na mag-increase ang beta-HCG levels, bababa po yan. Okay? So, pag bababa si beta-HCG level, ibig sabihin, hindi po maganda ang pregnancy natin. Kaya po, very important na makorelate natin ang ultrasound at ang beta-HCG level. Kasi po baka hindi nyo maintindihan, bakit ba ako pinapa-beta-HCG level? Ang mahal-mahal naman ito. It's because we want to check whether the pregnancy would likely become successful or it is failing. Okay. So, ayan. This is the picture. This is a real picture, ha? This is the photo of my third pregnancy na nag-miscarriage po ako. Kitang-kita na, ito na si baby sa loob, but wala pong heartbeat. So this is a picture of a transvaginal ultrasound. Isa itong transvaginal ultrasound picture showing a baby. Oh, yan si baby. Maliit, na wala pong heartbeat. Kaya miscarriage po ang tawag kasi po wala akong naramdaman. So ano ba pong gagawin? Yun na. Kailangan po ba talagang raspahan every time? Depende po. May 3 pong options. Pwedeng number 1, obserbahan. We'll just observe, expectant management. Kung kailan lalabas, dun na. Pag number 2, pag medyo hindi maganda at nagbi-bleed na, malakas na ang bleeding, kailangan nating i-evacuate or mag-curettage. RASPA. Yan ang RASPA. Number 2. Number 3, may medical management din tayo. Marami tayong options dyan sa market natin, mga gamot that can help evacuate para malabas po yung products of conception. Masyadong malakas ang bleeding, huwag nang hintayin, diretso na sa hospital. Yung mga ganon, you should be able to discuss it best with your obstetrician. So, how does a product of conception look like? Doktora, kasi may lumabas na parang ganun, yung red na malaki. Yun na ba yun? So, here, I'll show you a picture. Yan, it's one example, ano? Kitang-kita natin na si baby nasa loob pa po ng sac. Kasi maliit, I think nasa 6 weeks lang po ito. Ito po, mas obvious. I think nasa 8 weeks, 8 to 10 weeks, ganun na. Ito siya. Medyo obvious po. Makikita po natin ang baby nasa loob ng kanyang sac. These were all medically managed na miscarriage. Lumabas lang po on its own. Kaya I really tell my patients, I would like to thank my patients. Thank you very much for sharing to me these pictures kasi I really instruct them that if you feel like parang naiihi, masakit ng puso, naiihi, do not urinate sa bowl. Doon kayo sa floor para pag may lalabas, makita natin kung talaga bang clot lang ba, dugo lang ba, or may baby na pong kasama. So dito, you see, no, na may sa loob na at complete po siyang lumabas. Buo lumabas. Medyo problema pag medyo malaki na po because may kasama itong placenta eh. So, yun yung problem pag hindi nalabas lahat. Medyo pag malaki na po si baby, yan yung medyo mahirap. Baka hindi po complete lumabas lahat. So, again, if nasa bahay po, binigyan kayo ng gamot para mailabas lahat, you should check, kumpleto ba? Wala bang ibang problema? Hindi ba ito H-mole or molar pregnancy? Hindi ko alam anong Tagalog ng molar pregnancy. But anyway, uray, hindi ko alam kung if it's a Filipino term. But here in Cebu, uray po. We call it uray. So you should check. Kumusta naman ang nailabas ko? Dugo lang ba? May kasama ng baby? Or may kasamang dugo at baby? Pero hindi po kompleto lumabas lahat. That's very important. At pag may nakita po kayong ganito, please bring the specimen to the laboratory for biopsy just to make sure na baby lang ito, walang ibang problema. Okay? May tanong din, Doktora, ito lang yung nakita ko. Okay na ba ito? Ito na ba si baby? Ayan. Unfortunately, hindi po. Magkaiba po ang itsura nito at sa itsura ng may baby. Okay? if you can see, ano lang siya, parang meaty tissue lang. Did you know, hindi ito miscarriage. Isa itong ectopic pregnancy na ang nailabas ay isang decidual cast. Kasi kakapal yung lining, kasi pregnancy pa din yon. Pero kasi because it's an ectopic pregnancy, nilabas ng matres itong lining ng matres, kaya medyo it looks like a meaty tissue. But actually, hindi siya, walang baby. Kasi si baby, nasa tubes. So be careful. Doktora, nailabas ko na po lahat. Pero masakit pa rin po ang likod ko, ang balakang ko. Yan, kailangan talagang mag-ultrasound. Especially yung in areas na walang ultrasound sa inyo, you really have to come to a place where you can do a transvaginal ultrasound to make sure na hindi ectopic pregnancy po. Kasi pag talagang intrauterine pregnancy at miscarriage, dapat may baby talagang makikita. Okay? Or pag masyado namang maaga, we don't expect a baby. Again, it depends on what age of gestation nangyari yung pregnancy loss. Okay. We are at the complication already, ano? Doktora, ano bang mga risks or complications na pwedeng mangyari sa isang babae na nakunan or makukunan? Ayan. Number 1, bleeding. Paulit-ulit ko sinasabi. Pag kasi may natira sa mattress natin, it's nature of the uterus to protect itself. Ilalabas niya yan lahat. So, on its process of evacuating what is left inside na patay na, the woman will bleed. Okay? So, malakas yung bleeding. Pag ikaw medyo thin, yung store of blood mo sa katawan mo, konti lang din. So, you should be very careful. Pag malakas ang bleeding, do not wait na hanggat you will faint and you become pale. Do not wait before you seek consultation. I had one case. She bought an abortion pill online. At to be specific, hindi siya ang bumili. Yung friend. Kasi sabi ng friend, I want to be a good friend, doc. Gusto ko siyang tulungan sa problema niya. She is not prepared for the pregnancy, so she bought the best friend, bought the abortion pill online. Hindi ko alam kung saan, hindi ko na lang ginudge. Of course, kasi di ba doktor ako, I should be there to comfort and, help them move and heal from what happened. So, ang nangyari, parang ilang tablets daw yung ininom, 10 or 20 tablets. So, ang nangyari sa kanya, very, very painful. Dinugo the entire week. Nasa kwarto lang siya because she kept on bleeding. You know, when I saw her, she's really pale. Ang puti-puti na niya. And yung best friend, kasama. Kasi medyo she feels so dizzy. So you should be careful. Kasi pag naubos ang dugo sa katawan, ano nang mangyayari? Okay? Anemia also harms the heart. So kailangan, we should be very watchful. Number 2, incomplete expulsion or hindi kompleto ang paglabas. Is one sign kasi bakit ka nagbi-bleed, parang magkasama yan. Number 3, infection is a common complication, especially if pinalaglag at may ginamit na instrument para malaglag si baby. So it's an unsafe abortion, so very high risk of infection, or matagal nang nasa loob ang retained products of conception, mabaho na ang discharge, hindi pa rin nagpatingin ng doktor, ayun, nagka-infection tuloy. And because now that we are very much aware with mental health, kasali po ang depression sa complication ng miscarriage. Parang now kasi we're at a time na medyo aware na tayo na apart from the physical health, may mental health din tayo. And so this is a call to all our viewers, whether you're a friend, a relative, a husband, a mother-in-law, a sister-in-law, if you know that that person had just had a miscarriage, no matter how short or how long she spent her time with her baby inside her tummy, it's still considered a loss. I made this post because I too was struggling with a loss. You know what? This had been 3-4 years ago. But when I tried to read my blog again, naiyak ulit ako. This was a time where, naiyak ulit ako, oh my gosh. So, anyway, this was a time where I was so vulnerable because I did not expect na mangyayari sa akin what happened to my patients. And so I really went through a difficult time na hindi ko, yung healing ko was, I think, nahirapan ako mag-heal. Kahit they keep telling me, oh, it was just a chromosomal abnormality, it randomly happens. Hello? Okay pa ba ako? It randomly happens. So, yan. Okay? So, I made anong tawag dito? Gumawa ako ng vlog para matulungan ako sa aking healing. Okay, let's see. Wait lang medyo nag-lag yata ako. Okay lang ba? Can you please let me know if may problema sa broadcast? Ayan. Okay. Okay pa po. Thank you very much. Ayan. Kasi medyo nag-lag po sa akin. Okay, thank you. So, if you have time again, you read because this was how I managed to more or less survive from the loss that I had. So, my family really played a very significant role in my healing, my friends as well. No? Kahit gaano ka malawak ang kaalaman namin as obstetricians, pwede din kaming maging pasyente. So, I became a patient and had the same experience. So how do we prevent? Doktora, ayoko pong magkaroon ng miscarriage. Paano po ba yan na gusto ko pag nagbuntis ako, hindi ako makukunan? So preconceptional care ang tawag doon. You seek help from an obstetrician gynecologist even before you got pregnant. Say for example, doktora, uuwi na po yung husband ko. Gusto po namin magka-baby. So ang tawag doon, kasi hindi ka pa buntis, preconceptional care doon na didetect pag diabetic ka ba, pag hypertensive ka ba, may problema ka pa sa cholesterol, yung mga things like that. Masyado ka bang mabigat, kailangan ba nating i-lose yung weight mo? At least we have time prior to getting pregnant. Ang tawag again doon is preconceptional care. Hindi pa nabubuntis, inalagaan ka na. Iba yung nabuntis ka na, tas saka ka inalagaan. Prenatal care na po iyon. Ang preconceptional care, before nabuntis, may doktor na pong nag-aalaga sa inyo. And pag tanungin nyo ako, what supplement is that? I recommend folic acid po. Ang dami ng folic acid, by the way, sa market ngayon. Yung nasa pharmacy natin is folic acid 5 milligrams. Okay, just take it once a day. And true to how I practice, my craft. I am a lifestyle medicine physician, so I always emphasize in diet. Diet should be rich in fruits, vegetables, whole grains, vegetable oils, and fish. So ito yon, specific. Pag ikaw medyo mataba, try to lose weight po. If overweight, kahit overweight, if you just lose a little of your weight, kahit 5 to 10% of that, good na yan. Again, palagi kong sinasabi, dapat achievable, dapat measurable. So itong 5 to 10% weight loss within 6 months po. So we are able to prepare, Prepare well. So kunwari, doktora, 70 kilos po ako ngayon. Ito na pong pinakamabigat ko so far. Ano po bang gagawin ko? Compute natin. Ano bang 10% of 70? 7, di ba? 10%. Tama ba ang math ko? Diyos ko. Okay, anyway. So, 63. So, sige, let's try. Within the next 6 months, achieve natin si 63 kilos. Ganun. Para measurable siya. Wag namang mag-dream na from 70 kilos, maging 50 kilos kayo. Hindi naman yun achievable. So, ito, you target 10% of your weight. Tapos, we lose it. Diet. General healthy eating principles should be followed. This is what I always emphasize. Do not go on diet and decrease. Do not eat less, just eat better. You choose the food that you take in, but do not decrease the quantity. Improve the quality. Kaya eat better, not less. Okay? Choose the healthier ones. Kung magsasnacks man lang, edi pwedeng saging, apple, o yun. Women with high fertility diet, these fertility diet include higher monosaturated to trans fat ratio, vegetables over animal protein, high fat over low fat dairy, a decreased glycemic load, and an increased intake of iron and multivitamins had lower rates of infertility due to ovulation disorders. Much more miscarriage. So there is also a study that shows if the dietary pattern daw 3 years before talagang mas pinahaba pa o ang haba ng preparation natin. If 3 years before daw anong tawag dyan, samgyupsal, because marami pong complications pag we eat a high meat. Ito pa, really specified. Red pala, so yung mga steak, yung mga steak bawal po. Ayan. Okay. How about sa male fertility? In the males, doktora, si wife ko lang kasi siya naman magbubuntis. Oy, hindi Saan ba galing ang sperm? Ang sperm galing din sa inyo. So, consume a diet rich in carbohydrate. Parehas lang naman fiber, folate, lycopene, as well as consuming fruit and vegetable, which improves semen quality. And, ano ba to? Consuming lower amounts of both proteins and fats were more beneficial for fertility. So, kaya, not just the wife, but also the husband. So, importante kayong dalawa kasi kayong dalawa ang magtutulungan. Okay. Ito, exercise. I just want to emphasize, doktora, hindi naman ako mataba, tapos ipapag-exercise mo ako. So, papayat ako lalo. Oy, hindi. Here, look. Prevention of weight gain and maintenance of health. Ibig sabihin, whether you are heavy, you have normal weight, kailangan po mag-exercise. Ito yung recommendation for adults 18 to 64 years old. Minimum of 150 minutes per week of moderate intensity physical activity. I'm amazed. Ang daming patients na that are very conscious. Doktora, ano bang 150 minutes? Ano ba yan? High intensity ba yan? No. Pag high intensity, nasa 75 minutes per week lang po. So, pag moderate intensity, 150 minutes per week. Ano bang moderate intensity? Yung you can still talk, pero hindi na kayang kumanta. Yun. Yung kaya pang magchika konti, pero hindi na kayang mag-concert while ginagawa ang exercise. Yan si moderate intensity physical activity. Pero kung kaya pong mag-concert, lakad-lakad, chika-chika, hindi siya moderate intensity. Light intensity lang po yan or mild intensity physical activity. Yung naghuhugas ng pinggan, kasamang kanta-kanta, chika-chika, ganon, hindi po yon moderate intensity. In fact, hindi po yon exercise. It's just a physical activity. Ang exercise has routine, measurable, measured na activities. Yan po ang exercise. Or, ito. Doktora, hindi ko talaga kaya. Hihingalin na po ako ng 30 minutes every day. Kasi ang 150 means 30 minutes every day, 5 times a week. Tama ba ang math ko? 30 times 5 is 150. Okay. Doktora, hindi kaya. Hihingalin na ako. So, pwedeng 10-minute bouts. Okay? Times 3. 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes in the evening. Yan. That's how you divide your exercise kung hindi kaya ang 30 minutes. May marami pong option. Yan. Pwede naman po. So, or, kung may smartwatch po kayo, tingnan nyo po ang steps per day. If you can reach 10,000 steps, almost very good yon. Okay. So, I'm down to my last slide. So, just prepare questions already. Okay, very good. We have questions na po pala. Okay. I'm down to my last slide. I titled my presentation, Never Forgotten, because these baby that we lost may be lost but are never forgotten. With the stages of lost, di ba? If you have read my vlog, nandun si Dabda. I know you're familiar with Dabda. Ano ba yung first? Denial. Anger. Denial. ano ba 'tong nangyayari sa akin? Anger, nagalit-galit ka sa mundo, bakit hindi ako binigyan ni baby, pinahiram mo lang. Oh my ganon. Bargaining. Siguro if I do this, I do that, baka mabuhay ulit. Oh, you know what? I have a very close friend, sabi niya, baka i-ultrasound ulit, baka nagkamali lang. Oh my ganon. Oh, so yun. Ano? Ano yung sabi ko? Denial, anger, bargaining, depression, ayun na, andyan na yung iyak-iyak. And last is acceptance. Depende po kasi, hindi po lahat ng tao matutuloy sa acceptance. May iba, they spend a very long time in depression. But, you know what? I'm so blessed. Again, because of the people around me, I did not just end with acceptance. I ended with another A, appreciation. Paulit-ulit ko po yung sasabihin because even when I have a very strong personality, medyo I can survive mga trials, hindi ako iyakin sa mga trials na ganyan. But you know, played a very, kahit yung mga anak namin, no, the two kids that we had then, they were very understanding of the loss that we went through. Not just me. Kasi pag iisipin natin, ikaw lang nawala, ako lang ako, hindi. How about your husband? Kayong lahat po sa family na nawalan. So, let's support each other and let's appreciate each other more. Buhay po is borrowed. Hiniram lang po. At pwede po yung kunin anytime. Whether 5 weeks, 8 weeks, 12 weeks, 9 months, or kahit matanda na. So we should be thankful with the lives that are given to us by God now. So I will end my presentation. Pag may mga tanong po, just let me know. All right. So wow, thank you very much. May mga question ng nandito. Yes, thank you very much. Okay, let's start. Okay, I will answer question. Ay, oo nga po pala. Okay, ang gawin po natin, mag-ano tayo, okay, tama o mali muna. So, para may winners po tayo at the end. Are you ready? Sige nga po. Let's see pag you were able ma-sure natin. Okay, are you ready? Ready na ba ang question? Sige, hold on. All right, ready, set, go. Okay. Just type in the pop quiz number. So, tatlo lang. 1, 2, and 3. Lagyan ng tama if you think it's correct, the statement is correct, lagyan ng tama. Or if you think the statement is not correct, lagyan po ng mali. Again, please join because you will get the chance to win one of the 3 free online consultation coupons with me. So, try to answer kung ano po ang natandaan from the lecture that I had. Ayan. Okay, let's start. First question, pop quiz number 1. The most predictive of pregnancy loss is bleeding. Ito po ba ay tama o mali? That the most predictive sign of pregnancy loss is bleeding. Ang pagdudugo po ba is the most predictive? Tama o mali? Wow! Ang gagaling! Nakinig po. Ang sagot, let's see. Tama. Okay. Pop quiz number 1 is tama. Again, if there is bleeding, it's one danger sign of pregnancy. Okay. Next, let's go to the next question. Pop quiz number 2. Risk factors for a poor pregnancy outcome can be detected even before pregnancy happens. Again, pregnancy risk factors or yung malalaman natin na if there can be problems or poor pregnancy outcome can happen will be detected even before pregnancy happens. Pwede ba nating ma-detect before nabuntis si mommy? Is it tama o mali? Wow naman! Very good, oh, ang mga audience. Very good. Good job. The answer is tama. Yes, no? Again, preconceptional care is very important. Even before getting pregnant, you seek help from an obstetrician, gynecologist already, so we will be able to correct those problems. Okay, good job. Okay, we're down to our third pop quiz question. Pop quiz number 3, the best time to seek prenatal care is on the 3rd month of pregnancy. Tama o mali? The best time to seek prenatal care is on the 3rd month of pregnancy. Is this statement tama or is this statement mali? Wow! Wow, wow, wow. Wonderful, wonderful. I'm so happy na ang gagaling ng mga audience talaga. Number 3 or the pop quiz statement number 3 is mali. When is the best time to seek prenatal care? When you know that the immediate time that, buntis ako, you seek prenatal care agad. Huwag nang hintayin, sa 4 months ko na, sa pagmalaki na ang tiyan ko, saka ako magka-prenatal. No. The moment that you know that you are pregnant, you seek prenatal care right away. Wow, congratulations! So, we have winners here already. Okay. Ayan, ang gagaling. I'm so proud because you really listened. So, we will reveal daw po the winners later. Okay, so let's answer, the questions from the audience. Pwede na po ba? Alright. Okay. So, sige, let's go on the first question. Okay. May followers question daw po. Okay, you can type in your questions muna. We'll entertain live questions after the followers questions are given. Okay. Let's show the followers question. Okay. Followers question, ito yung mga followers sa page na nag-private message. Number 1 question, Doc, how soon pwede mabuntis ulit after makunan? If you really want to get pregnant right away at there are no problems, even after 1 month, pwede na po kayo mabuntis. But if the cause of the pregnancy has to be corrected before another pregnancy, I think you should delay the pregnancy first and correct that risk factor that could have possibly caused the miscarriage. So, again, kung risk of getting pregnant, you can get pregnant immediately. Pwedeng magbalik ang ovulation mo in 8-9 days to 3 weeks. Pwede ka nang mag-ovulate ulit. But the question is, if you are not able to correct, I don't think there will be a different outcome. Baka makunan po kayo ulit. Okay? So, yan. You can get pregnant right away, even after a miscarriage, after a month. Okay? Number 2, Doc, meron bang kaso na nag-positive ang pregnancy test tapos tinugo? Nung nag-ultrasound, wala naman pong nakita. Yes. Okay. If documented talaga na positive yung preg test or may iba kasi alam na nila ang beta HCG, yung sa laboratory talaga, yung blood talaga ang kunan, tapos positive yung beta HCG level. Ang tawag po doon, biochemical miscarriage. Yung buntis siya because of a positive pregnancy test pero wala pong nakita sa ultrasound, wala din pong products of conception na lumabas, positive lang po ang pregnancy test. Ang tawag po doon, biochemical miscarriage. Kasi sa pregnancy hormone lang po siya nag-positive. Okay? Yes, merong kaso po ng ganon. 3. Doc, please just hide siguro ito. Hide my identity po. Hindi pa kami ready for a pregnancy. Can we still do something about it? Nako po, buntis na, I'm assuming buntis na po kayo. Dito kasi nagkakaproblema tayo, because there are a lot of issues regarding this topic. But since this is my advocacy and this is really something that I really am very open about, pag nabuntis na po kayo, tao na po ang nasa loob. It's a different human being. Hindi po part sa inyo yung bata. It's yours and your husband's. One unique being na po yan. Nagkataon lang nakitira po sa inyo kasi hindi pa po nilang kaya outside the womb. Pero tao na po yan. So kung hindi kayo ready at if you are contemplating po na i-abort, abortion po, induced abortion po ang tawag doon. Liban sa hindi po yan legal sa Pilipinas because we are a very religious country and you might want to talk it over with me. You can visit me, pag-uusapan natin, or if you trust a priest or whoever that's trustworthy mentor that you have with you, please do not hesitate to talk with that mentor. At sana po ay maliwanagan po ang pag-iisip natin. Because we have no right at all to terminate any life. Kasi buhay na po yan. Nagkataon lang na nasa loob po ninyo. So, I am imploring that you seek help. You talk to somebody trustworthy na alam niyo pong may wisdom sa mga bagay-bagay na ganyan. Okay? Ang hirap naman. Number 4, hindi po ako naraspa nung nakunan ako. Kailangan ba magparaspa para po mabuntis? Hanggang ngayon, parang na-mention ko na po ito. Hindi po kailangan na magraspa. If there was complete expulsion of the products of conception, yun na po yun. Hindi yun po ang reason bakit hindi kayo nabuntis. You can look into your diet, you can look into your lifestyle, look at your weight. Baka po, kasi obesity does not just give us a higher risk of miscarriage. It also affects the fertility. Look at the lifestyle of the husband. Baka may problema po along those ways. So we can kindly look at those things, and if you need help, I can guide you through it. Yan po, that's the reason why gusto ko po ang lifestyle medicine. Okay? Number 5. No, are you pro-life or pro-choice? Ayan, okay. I'll make this clear because I keep telling that this what I'm doing is for women empowerment. That's right. But I agree that we have our rights to choose what's good for us, but if it talks about the lives of others, wala po tayong right doon. So, do I really have to choose my pro-life, pro-choice, and ganon? I am for empowered women, but I am a very strong pro-life advocate. I defend the unborn, the defenseless children. That's the reason why I'm here in front of you now, because I want to raise awareness na hindi po lahat are blessed to be given that baby. Ang dami-daming who has spent millions of pesos para lang po mabuntis. So let's not waste the gift that is given to us, no? So it's not a question of being pro-choice, because as long as our dignity as persons are intact, yan yung importante. And if we kill other people para we get what we want, hindi po yan maganda. Di ba ayaw nga nating apakan yung iba for us to be successful? Di ba pangit yon? Lalo na if we kill others because we think we decide for them. So hindi yan choice, because you're giving that other person no choice because you are deciding for that person. Nagkataon nga lang na nasa loob niyo po. So I hope, grabe naman ito. Maraming salamat po. Okay. Alright, parang naghahang ako. Okay, sorry. Okay. So, let's answer. Okay na ba? Sige, audience naman po ang let's give the floor to the audience. Okay. Good PM po, Doc Shi. Ask lang po, does methotrexate still being used to resolve? Yes. Okay. Hindi ko mabasa ang name, but yes, methotrexate for my patients who had ectopic pregnancy and sought consult early. They went to my clinic early. they had positive pregnancy test, nag-ultrasound sila, wala pa silang nararamdaman, they went to my clinic right away, na-resolve yung ectopic pregnancy through methotrexate. So, yes, I still do it. Oh, hello. Yes. Okay, I'm one of Doc Shi's patients who had miscarriage last year and followed her advice for me to get pregnant again. Oh my goodness, congratulations. Okay, yes. It's my honor. It's a privilege to be able to know you through my service. I'm very blessed and happy to be able to know you. With strong faith and a healthy lifestyle is the key. Thank you very much for this testimony, Pat. I'm so honored to be able to hear this from you. Wow, thank you very much. Okay, may ano pa ba? Okay. Hi, Doc. I had miscarriage last January, but I have history of PCOS. Is it one of the reasons why nagmiscarriage ko? Car, yes. Unfortunately, yes. It is one because polycystic ovarian syndrome has imbalance of the hormones. If may problema po kasi sa hormones natin, hindi masyadong maganda yung pagkaka-prepare ng katawan natin for the pregnancy. PCOS is a long-term condition. Para siyang hypertension, diabetes, hindi na yan nawawala. But we can control it through, again, the lifestyle interventions that we give you. So if you need help, I help a lot of patients with PCOS, and yes, hopefully you are one of those that will have a successful pregnancy after. So please message at the page so we can help you through that. Okay? So, okay. Hi, Alma. Hi, Doc. I'm 43 years old. Mabuntis pa kaya ako? Well, of course, as long as you are still menstruating, nangingitlog ka pa, there is still chance of getting pregnant. But as I was saying earlier, isang risk factor of miscarriage ang medyo nasa ganun na age group. But as long as you visit your doctor before getting pregnant, you tell the doctor, Doctora, please help me na pag mabuntis ako, the baby we are just really instruments of God. We're just here to channel, no, the blessing of God. So nothing is impossible. It's just that there are just a lot of things that we should prepare para po yun, para good ang outcome natin. Okay? Okay. Good outcome po. It is safe to take folic acid every day. Okay. All right. Every day to get pregnant. Actually, okay, let's correct this one. The folic acid is an antioxidant. One of the reasons why we're having a hard time getting pregnant is because there is a lot of reactive oxygen species in our body. Dok, ano ba yan? Bakit ka nagsasalita ng alien? In other words, we have a lot of harmful substances in our body. Of course, with use yung nilalagay natin sa mukha, sa hair, yung mga fabric conditioners na nasa clothes natin. Ano bang very practical example? Smoking, alcohol beverage intake. Those are just a few things of the harmful substances that we can introduce in our body. And folic acid is an antioxidant. It helps, no? It helps address, or it helps keep those things not harmful to our body. Parang it renders it not Let's see. Ayan, okay. If the harmful substances is too hard for the antioxidant to handle, that becomes a problem. Okay pa ba ako? Let's use siguro. Okay, sorry. Ayan, madilim. Wait lang. Yan. Okay na ako. Okay, sorry for the technical glitch, ano? Okay. Folic acid. So to answer this question, hindi kasi ang folic acid that will cause us to get pregnant. Hindi po ang folic acid ang main reason bakit tayo nabubuntis. The reason why nabubuntis tayo is because nakaya ng ma-fight mas maraming antioxidant kaysa sa reactive oxygen species. So, ang nangyayari, magandang quality of egg ang na-produce natin, kaya successful po ang pregnancy natin. Folic acid will just help. And if a woman gets pregnant, it also prevents the neural tube defect risk of the baby. Ano ba yung neural tube defect? Yung nawawala ang skull, may mga butas dito sa likod ng bata. Those are neural tube defects. Those can be prevented by drinking folic acid. So, to answer this question, tanong ko lang po, is it safe? Folic acid is safe. Yes, but it will just help, no? Enhance the chances of you getting pregnant. The bottom line is it's still you preparing the pregnancy that really matters most. Okay? Just an idea. Before I had the miscarriage, I took everyday folic acid. Ang dami-dami kong folic acid na sa isang bag. Parang sabi ko to, isa sa vlog ko. Isang bag ang folic acid ko. I really took it religiously, pero nakunan pa rin ako. Why? Because I reached my weight. That time was 62 kilos. Tumaba ako masyado. Nag-change ako ng wardrobe. Hindi na kasya lahat yung scrub suits ko. Parang kumakain kami ng lechon. Like, wala lang. Gusto lang namin kumain ng lechon. Nag-lechon kami, nag-pork. So, after the miscarriage, talagang nag-360 degrees turn yung life namin. We started with fruits na, nag-vegetables na kami. We underwent the transition. Yung tinuturo ko sa patients ko, I went through it all. Kaya siguro I'm very passionate in teaching this because I experienced it. So I went through that process, and now, when I had a successful pregnancy, yung baby ko na pregnant ako nung nagpa-plant-based ako, she loves fruits and vegetables, I tell you. Talaga, super favorite niya ang fruits and vegetables. Okay. So, I hope I was able to answer that. Folic acid is safe. Wala namang problema. Okay. Ang dami na palang question. Sorry, ang daldal ko. Ayesha, Doc, ano ba ito? Is real and with PCOS and my chance pa na magka-miscarriage. Is real? Ay, sorry, Ayesha, it doesn't, is real, okay. Kung PCOS po kasi ang problema natin, ano? Okay. Yes, okay. Okay. We should be very careful because I had one patient, PCOS siya. Parang medyo ano na siya parang she's running out of time. Gusto niyang madaliin. Alam naman natin, di ba, may mga gamot sa market na that can induce the ovulation. Parang ovulation induction agents, ganun. I think you are familiar with that because a lot of our viewers are very educated and you know that. Yes, she got pregnant, but because the preparation was not very wonderful, parang ganun pa din, hindi na change yung lifestyle. She relied too much on medications. Nakunan siya. But when she went to me, I let her understand what is the foundation, what's really the basic, what should be the must-do for us to get pregnant. When she understood, kahit PCOS siya, na-resolve yung PCOS niya, she was able to produce ovulatory cycles at nabuntis. So, I'm very happy to be hearing news like that. Okay? So, okay. I think na-mention ko po ang APAS kanina. Doc, ano po ang ma-advise nyo sa merong APAS? You really have to visit number one, an immunologist. If you are from Cebu, meron po tayo. Hello, Dr. Fajardo Neri, one very good friend, and the wife of our chairman in Perpetual Succor Hospital. I know Dr. Liza Sulay. Those are the ones that I refer my patients. These are immunologists. You can go there, and also to a maternal fetal medicine specialist. Yung mga obstetrician who trained as maternal fetal specialist. Okay, so yon, that's my advice for APAS. Okay, hello po, Doc. It's been 4 years since I have been pregnant, but sadly, it was ectopic and undergone removing my right tube. Methotrexate twice was injected, but still it did not melt. And ended losing right tube. Sano, will pray for you. Really wanted to be pregnant and have normal pregnancy. I'm 36 years old. Please help. Okay. Sige. So, does this mean your left tube is still intact? Based on what I understood with what you wrote here, your left tube is intact. We can look into it pag patent naman, and then sige, let's try, okay? Let's try because case to case basis kasi. Let's see your case first and then we'll see what I can do to help you po. Okay? Okay. Ayan. Hi, Doc Shi. I'm diagnosed because my OB has let me take my Rai, folic acid with ferrous except glutathione. Is glutathione safe po? Okay, as far as what I know from my derma friends, glutathione is best administered, IV. So, we should be more cautious. I don't know if that glutathione is even FDA approved. So, I would suggest that whatever your obstetrician advises you to do, kindly follow po. Okay? So, that's my advice. Okay? All right. Sige. Ay, okay. You had HSG on left tube is patent. Also went through with polypectomy a year ago. Okay, I understand that you have been doing all that you can for you to be pregnant. Okay, so I'm happy that the left tube is patent. So at least there is really a high chance of getting pregnant because even when you only have one tube, as long as it's patent, kaya niyang magganon, kukunin niya yung nangitlog na kabilang ovary o dito sa side niya. Pwede yun. Okay. Alright, okay. Okay. I think I have answered. It's okay lang. I think I have answered all questions na po. I'm very, very happy that you all took time to be with me this afternoon. Let me know if may topics po kayong gusto nyong pag-usapan natin. I'm very much open with that. My online assistant, si MJ, is very active. Nagre-reply yan agad sa inyo. Tell her pag may mga increase po kayo. Okay? All right. So, let's reveal our winner. Okay. So, okay. Sige. Are we ready? Okay. Our first winner for pop quiz number 1, yung nakasagot ng tama. Oh, Reina Aldave. Wow! Congratulations to you. You won a free online consultation with me. Kindly message the page for you to be able to claim it. Also, by the way, if you wish to transfer the online consultation coupon, you can do so. Just let MJ know that, MJ, I think I can afford the consultation fee of Doc Shi, but I have a friend who's quite having a hard time and she really needs an advice. Can I share the free online consultation with her? Sure, you can do that. So you can be a blessing to others too. Okay? So you can share. Okay, number 2. Okay, number 2 winner. Tama o mali? Number 2 winner. Let's see. Okay. Number 2, ready. Teng. Okay. Wow, early Pangilinan. I think I'm very familiar with you. Hi, thank you very much for participating in our in our pop quiz tama o mali segment. Okay? I think we're down to our last winner. Okay. Congratulations, J. Genevieve Buagas Carlon. You got the right answer. And the first one also. Congratulations for participating. Okay? So I'm very happy again to be back to Dangpanan live series. And I'm so honored to be able to share with you the topic. For those of you who had their own stories of pregnancy loss, share your stories. We'd love to hear more about it. Okay, so if there are questions that I failed to answer, please message the page because the next time that we have a live health talk series, we'll address there. We label it as a followers question. Yung mga followers ng page, you'll have an opportunity. You'll have an opportunity to what you call this? To nawala tuloy ako. Yes, earlier I saw yesterday. Okay. I'll see you again online. Or pwede you share if you have somebody who knows who need. Kasi afford mo naman ang consultation fee ko. So you share it with others. So you will be a blessing to others also. Diba? Okay. Again, if you have questions, just chat through our Facebook page para po ma-address natin by the next time na may live health talk series po tayo. I'm planning to do this regularly na po every month. So please watch out for announcements for live series. Okay? Nakikicongratulations po si Leslie Samaco po sa lahat. Okay. Thank you very much once again for your time this afternoon. I hope you're as glad as I am. We should always remember that being healthy is a way of life because it is not just medicine, it's lifestyle. Once again, I am Dr. Shi Armero, and you are watching Dangpanan, a live health series. Before I end, I want to thank Architects Berame for this wonderful overlay. Bago po ang overlay ng Dangpanan sa screen natin. Thank you very much. And of course, to all of you who are here this afternoon, from my family there in Bohol, from my cousins, aunties, uncles in Butuan, all in Mindanao, the Halads in Mindanao, hello po sa lahat. And the Armeros from Bourbon, hello. Okay, thank you very much for this very fruitful afternoon with you. I'm so happy once again, and I'll see you again next month for another Dangpanan Live Health Talk series.